to do this one. I'm talking about wounds and infections, something none of us like to see. First, going to talk about wounds. There's a lot of overlap with them with these, but with ankle arthroplasty, but I'm going to kind of go through a little bit of each of them. So unfortunately, they happen. Some of the data, it's reported between 3% and 34%, probably somewhere in the middle. I think it probably depends what your definition of a wound problem is. But they happen, certainly. We know they do here. I would say is the best offense is a good defense. And so being able to try and prevent these as much as possible, then you don't have to worry about them as much, because nothing, at least for me, crushes your soul in clinic like something. This is obviously in the operating room, not one of my patients I operated on, luckily, but nothing can get you like going after a great x-ray and then you walk in the room and you see a wound. The key, I think, in my opinion, is just being able to acknowledge it and act on it, not putting your head in the sand and just putting it back in the cast and hoping that it'll heal, and really just making sure to follow those patients. And so the main things, kind of different areas to touch on. First is patient selection. We're going to kind of go through some of those risk factors here, but generally speaking, you want to look at their healing potential and then also, in my opinion, their compliance potential. Are these people going to understand how sensitive this wound is initially, how much they need to really just shut things down and elevate, not do too much in their dressing or their whatever their immobilization is, and just take it easy if they can handle that or not. Surgical technique, really meticulous soft tissue handling, no self-retaining retractors. Try to never put tension on both sides of the wound at the same time, if at all possible. There's some varying data going to go through in terms of TXA.